Namaste and a very warm welcome to day 2 of our 7-day webinar series. It's wonderful to see such an enthusiastic Sangha here, all coming together to learn more about the secrets of yoga therapy 2.0. Yesterday, Yogacharya Dr. Anandabal Yogi Bhavnani ji shared his powerful and uplifting wisdom about the foundations of Yoga Chikitsa in Rishi culture Ashtanga Yoga. He gave us a deeper understanding by introducing us to 360 degree of Drishtikona, the perspective, helping us to see the many yoga therapy ways that can help us in healing and balance into our lives. Today, we are very fortunate to have Professor Dr. Meena Ramanathan ji with us. She will be sharing her knowledge and expertise about women's health and empowerment through Yoga Chikitsa, rooted in our rich Gitananda Yoga tradition. Her depth of knowledge and her compassionate way of sharing makes her an inspiration to students and practitioners alike. Before we begin, I invite everyone to gently close your eyes and join me as we invoke the Guru Gayatri together. Om Tat Paramparyaya Vidmahe Jnanalingeshwaraya Dhimahi Tanno Guruhu Prachodayate Om. Om Yoga Maharishi Dr. Swami Gitananda Guru Maharaj ki Jai. Om Puduvai Kalemamini Puduvai Shakti Yoga Charini Ammaji Meenakshi Devi Bhavanani Guru Mata ki Jai. Om Sri Guru Bhyo Namaha Harihi Om. It's my privilege to introduce our esteemed speaker for today, Dr. Meena ji, who is highly respected yoga therapist, researcher, and a teacher. She currently serves as professor in yoga therapy and principal of the School of Yoga Therapy at ISCM Sri Balaji Vidyapeeth in Pondicherry. She is a senior member and teacher of the renowned Gitananda Yoga Parampara, trained under the expert guidance of her guru, Yogacharya Dr. Anandabal Yogi Bhavnani ji. Her academic credentials are vast and impressive. Dr. Meena holds a PhD in yoga, being the first woman to earn this degree from Pondicherry University. She also holds MSc, MPhil, and postgraduate diplomas in yoga, along with degrees in science and English. She is a certified yoga therapist from the IAYT USA and leads as the Vice Chairperson of the Indian Yoga Association, Puducherry chapter. Dr. Meena ji also serves as the lead examiner for the Yoga Certification Board for Ministry of Ayush and contributes as a subject matter expert and task force member for the CSIR TKDL project for Government of India. Her expertise is sought after in many academic and policy forums, including her role as an external expert for doctoral committees and board of studies in various institutes or universities. She is additionally a journal co-editor for the Journal of Ayurveda and Yoga Studies at Loyola Marymount University in USA. Her research contributions are truly prolific, with over 108 scientific papers, 26 abstracts, 3 authored books, 6 chapters in edited volumes, 12 copyrights, and 15 compilations to her credit. Her special areas of interest include Divyanga Yoga for children with intellectual and physical disabilities, yoga for senior citizens, and care of the transgender population through yoga therapy. Among her numerous honors, Dr. Meena ji has received the prestigious Lifetime Achievement Award from AICTE in 2023 from the Government of India, the Yogalakshmi Puraskar in 2024 for outstanding service to the women and special need communities, the Women Icon of the Year Award in 2024 again from Women of Substance Network, and the Major Dhyan Chand Award for the Best Star Coach. Most recently, she was honored as Yoga Chikitsa Acharya by the Indian Yoga Association during the International Yoga Summit, recognizing her outstanding contributions to scientific and inclusive yoga therapy. Today, she will be sharing her depth, insights, and evidence based practices on women's health and empowerment through Yoga Chikitsa, grounded in the rich therapeutic tradition of our Gitananda Yoga. Her work masterfully integrates ancient yogic wisdom with contemporary scientific research, demonstrating how yoga can be a transformative tool for holistic health and well being for women across all ages and conditions. This webinar will be followed by a question and answer segment, so please feel free to type your queries into the chat or in the question and answer box, and we will do our best to address them all. It is with immense pleasure that I now invite Yogathilakam Professor Dr. Meena Ramanathan ji to begin the session. Ma'am.
Namaste, everybody, and thank you so much, Dia, for that. Truly appreciate all the words that you have said. I hope I live up to that. And Vanakkam and Namaste to everybody here. My humble pranams to all of you for being here. So without wasting any time, I'm sharing my screen right away. I hope my screen is visible. I'm just making it full screen. Yeah. So thank you, first of all, for this wonderful opportunity to share a few things that I have learned from and through the Gitananda tradition. My gratitude and pranams to the Guru of Rishi culture, Ashtanga Yoga Parampariya, and my acknowledgements to Yogacharya Dr. Yogi Bhavnani sir, my guru, from whom I have learned everything. So whatever I am, and this is my humble dedication to dear Ammaji. Again, she gave me a new life, gave me the rebirth at the most appropriate time. And here I am in front of you. So thank you, dear Amma. And yes. So who is this? A wife, mother, daughter, sister, friend, the backbone of the family, physically weaker, but mentally a stronger person, a patient, tolerant, perseverant, and compassionate person, competent, versatile, successful, bold, beautiful, multifaceted, multitasking personality, who's dynamic at work, doting at home, who is all that and more. None other than a woman who's also called Nari, Stri, Mahila. Different terms are there to, symbolize a woman. And when I went into this etymology, the root of what woman, the term means, Stri has come from this word, the root word, strich, which means like one who expands. It represents a concept of expansion. And Nari is often, mingled with the term Shakti, which symbolizes women as representatives of energy, power, and vitality. And the term Mahila has the root word Mah, which, it means to honor, to respect, to worship, to revere. So that, translates as she who's honored and respected. So a woman who can expand, representing energy, power, vitality, and one who's honored and respected. So that is a woman. And woman has always been worshipped as Shakti. In the Mahanirvana Tantra, Shiva addresses Shakti as you are the supreme consciousness, You are the mother of this entire universe, the Jagat Janani. It is she who creates, protects, and dissolves. The Shakti or Devi is associated with three gunas of the Prakriti. And Saraswati, represented by the Jnana Shakti, Lakshmi, Icha Shakti, and Durga as the Kriya Shakti. So the Kriya Shakti, goddess Durga, is depicted, as a courage, as an aspect of courage, valor, power, strength. And she is epitomized as the Shakti who wards off all the negativities. And she is often depicted with many hands. And that is, a representation for Nari as a multifaceted, skillful, and capable energy to do multiple tasks all at one time. And goddess Lakshmi, she is implied as the complete spiritual well being, abundance of skills, talents, wealth, prosperity, and all. And the owl, which is her, the vehicle, represents the need to remain vigilant as well as grounded. And she's always represented as seated on a lotus, signifying one is water, which keeps flowing, because stagnation is not good. Stagnation, often causes many problems. So you have to keep flowing with the flow. And it also represents, detached attachment, being there, but it's not attached to the water like the lotus. And goddess Saraswati, Sara, the essence of Swa, the self. She is the one who bestows the essence for each and every individual. Goddess of learning and representation of what we call as wisdom. Express, enables shatter ignorance, promote the power to analyze, discriminate between the good and the bad. And, her vehicle, the swan, symbolizes the power of discrimination, viveka. And the swan has the power when water and milk are mixed and kept in front of the swan. It can just take in only the milk, leaving behind the water. So that is the power of discrimination. Absorb what needs to be taken in and throw away what need not be. So across the globe, women need to be, juggling many balls all at one time and see that not one ball falls off. And yoga is a real boon and blessing to women, a means to achieve, handle all these responsibilities all at one time. And Gitananda tradition truly respects women, gives them their due place, the due respect, and the tradition, the rich tradition has so many beautiful techniques and aspects and concepts theoretically that have been given as a blessing to nurture one the physical body and the subtle levels of existence, to stabilize the emotions, empower the minds, evolve spiritually, and to live harmoniously as the custodians of family, society, and culture. As Ammaji usually represents women as custodians of yoga. And Ammaji also emphasizes that women are Shaktis, the upholders of family and culture, capable of passing the yogic values to the future generations. So these are the stages of women as per the Western classification, as per the Tamil Sangam age. So why I'm, why I'm sharing this is because we need to understand that it is not just one stage. As a woman is born, a baby girl, and then adolescence, and then grown up women, and then menopausal, and then post menopausal. There are different stages. So I have just divided into broad classification. One, adolescence, where the techniques I am not going into detail right now. So what are the key health concerns in this stage? The menstrual irregularities, the acne, the pimples as they call it, The girls, little girls, are so much worried about, how they look, and the pimples are really, really very irritating, and they get so angry with that. And PCOS is a booming issue nowadays. The nutrition and growth that we need to, take care of in this stage, the mental health, because like I was saying, poor self image. Anybody, their friend always looks very beautiful. I don't look good. My nose is too small. And, I don't have long hair. See how tall she is. I am very short. And see how plump I am. She is so slender and beautiful. So there's a comparison that always goes on, giving, like themselves that poor self image and low self esteem. Adolescents often face stress, from various aspects. One is their school, and then the other things that, and despite all this, there's the hormonal changes which are also taking place, the mood swings that happen with the hormonal changes. And the other thing is, like, girls are more prone to the glandular imbalance. So the hormonal imbalance is often seen. And yoga is a very, very good, supporter of regulating the endocrine system. It's in fact, balancing the whole being together with every sphere of existence. So here, just in this context, I'm saying that the glandular imbalances are regulated and health is restored. The homeostatic balance is restored in all, like the psycho, neuro, immuno, endocrine systems of every woman, which is a very, very good thing. And as far as the lifestyle and philosophy goes, the Gitananda tradition emphasizes on yama niyama training, the truthfulness, self-respect, analysis of the self, moderation in everything, where that is very, very important, which can be applied in life as well. And the yogic diet, that the sattvic diet, which is light on regular timings, the quality of food you eat, all that. Apart from this, the bhajans, the mantra chanting, the arts, Bharatanatyam, classical, the singing, and all these to balance the emotions and to channelize your energies into something creative. So, what are the rationale that we, behind the yoga practices in this stage? It is like, for one, musculoskeletal development. So that should be ensured that they develop properly. And posture related issues. Because of the low self image, the shoulder starts stooping. So the growth is affected because of that. And the other thing you must have seen, girls carrying heavy, heavy bags with the whole books and everything, the loads they carry. So it is often like this, that they are carrying it, and the loads, again, further, like giving a cause for stooping of the shoulders, and long hours of screen time. So the therapy that we are focusing on here is to ensure flexibility, strength, and proper posture. And this, if we lay foundation now, it ensures their proper growth, because the adult stage, where they have to take up so many other responsibilities as a woman, it'll ensure that they can do it very easily. And menstrual regime, menstrual care, all that needs to be supported. And apart from all this, the mental wellness. So what needs to be avoided here is, we tell, the growing phase. Sir always keeps telling, the oli mudras should not be done. For example, the vajroli, and anything which is forceful on the spine, which affects the growth of the spine, should not be given to them. Other than that, all the postures can be done. Excessive strain, excessive stretching, anything and everything should be done under supervision. So a few given techniques, that suggested techniques, depending on the individual needs, is what I have listed here. And I'll be sharing this PPT with Nilachal. You can take it from him if all these if you want to go through. A few postures which can be adopted, and research study dysmenorrhea, which is a very, very big problem in this adolescent age. Studies have established and shown that dysmenorrhea, which is the low abdominal pain and all that, which the discomfort that goes with that, there's a very good relief from that pain, reduction of pain and discomfort in women due to dysmenorrhea with the yoga practices. The pathway has been given here. I'm not going into that. And another study for this stage, I was saying that the PCOS is a very big issue in this stage. So what they say is that the study has established saying that the potential of yoga therapy in reducing the hormone levels, like regulating the hormone levels and restoring the menstrual cycles, improving hirsutism. Hirsutism is the unnecessary growth of hair on the face, and acne, the pimples. So yoga offers a holistic approach in alleviating the physical and emotional burdens of PCOS. So coming to the next stage, the yoga, the young adulthood, all the reproductive stage, which is spanning between 20 to 40. So what are the pre-concerns here? One is the fertility issues, pregnancy related changes, how they adapt to it, and fatigue, which goes with that. And lifestyle related changes, issues like obesity, physical inactivity, which leads to obesity, and then stress, and depression, which is often, like sir very beautifully explained yesterday, obesity and depression, how one could lead to the other. Mental health issues like career pressures, postpartum depression, post delivery, and the what are the preventive screenings that could be done? Often is one is pap smear, and the other is regular breast examinations, mammography as it is called. And then suggested lifestyle attitude, which Yama Niyama suggested things are emphasis on, the balanced sense, which is wise use of the sexual energy, and saucha, cleanliness, ahimsa, self-care without harm. Because often, there is this, I am of no use, I am useless, I am good for nothing. And all this keeps hurting the woman. So it is himsa, right? So how? Just come out of that. And then santosha, contentment. Guiding relationships, marriage, and family life. In the Gitananda tradition, young adulthood reproductive stage is seen as the time of Shakti, of energy, fertility, creativity, and responsibility. The practices suggested support the hormonal balance, menstrual health, emotional stability, and preparation for the motherhood, simultaneously channelizing prana into higher spiritual evolutions also. So the rationale behind the practices that we would choose would be to strengthen the pelvic floor muscles, and then support the reproductive health, ease the pregnancy discomfort, boost energy, improve the stamina, flexibility, and circulation, maintain the vitality in the hormonal systems. Suggested practices, the chart is there, and pranayama. One regular, the must practice in this stage would be Ashwini Mudra, the Moola Bandha, for toning the pelvic floor and for rejuvenating the reproductive energies. And Lagu Shanka Prakshlana, that is a practice which is part of the Shatkriyas, which is a very, very special practice in our tradition to regulate and prevent the menstrual irregularities. It is often associated with the functionalities of the stomach, the digestion and all that also. But this practice ensures and regulates the flow of apana, which, like if it is not okay, leads to many of the other reproductive issues. And in this, the subclassification during pregnancy, which is a very, very important phase in every woman's life. A woman is made up in such a way, very, very specially made, to have a life grow inside her, to accommodate a baby inside her, give life, nutrition to that baby so that it is alive for almost 9+ months. She's carrying all that weight, and the pelvic region, the bones around the pelvic girdle, is especially made to support, to hold the weight of the baby as it grows. When a baby is born, it is roughly, anywhere between 2.5 to 3 kilos or even more. So that amount of, the baby is being held inside, the weight, along with that, the amniotic fluid and everything else adds up. So approximately around 5 kilos. So you can just imagine the strain that is there. She sustains all that. She waits for these months, perseverance and patience, and she gives birth to a new life. That's very, very important aspect of every woman's life, I would say. And the teachings in our tradition emphasizes safety, gentleness, and attunement to the mother-child bond, which is very important, which starts right from day one, the day she understands she is pregnant, and not from the day one the baby is born. No. So that is very, very important. And avoid, what is to be avoided while pregnant is the prone postures needs to be avoided, and inversions should be done with care. If that woman is a practitioner from her childhood, she could go on, but again, it's under supervision. It is always better, and under medical guidance also. Forceful pranayamas like Kapalabhati needs to be avoided. Overstretching, jerky movements, the strain that causes, breathlessness, pain, or fatigue during the practice has to be avoided. The spirit of the practice should be not to push the limits, but for nourishing two lives that she is holding inside also. Helps reduce pressure, balance the hormones, improve the sleep quality, and prepares for natural birthing. So again, I have just divided into the first trimester, where the focus is on calmness and protection of the baby, because it is still growing. Very much the care should be taken in the first 3 months, which is very, very vital in the baby's growth. So again, what needs to be avoided, what can be given, I have just listed it out here. And in the second trimester, focus is on stability and improved pelvic circulation. That should be ensured. And in the third trimester, what needs to be ensured while giving the yoga therapy is relaxation and preparation for the delivery. The pelvic, muscles, relaxation of the pelvic muscles, and opening up of the pelvic muscles need to be ensured. And the practices are done in what we call as the semi-recumbent position, which is very, very comfortable. I'll show you a few of the research work we have done, which was all done in this position only. And yeah, so this was part of the MPhil study by one of our students, Dr. Vasundhara, who's also a naturopath, and she's now pursuing this with her PhD in this same topic, where she's focusing on sleep deprivation in the women, the second and third trimester women, which is a very, very common finding. So you can see how from the chair she's guiding the women to do the practices, and most often from the hospital beds you can see that they are doing, the Sharabha Kriya, Pranava Pranayama, every practice. This one is doing the Kaya Kriya from the bed. So anything and everything under guidance and supervision. So this is one of the studies which shows the effect of Pranava Pranayama on the fetal and maternal cardiovascular parameters. So 3 interventions were taken: breath awareness, listening to Om, and the Om which was chanted by Ananda sir, and performing the Pranava Pranayama, which was given on 3 consecutive days. And what was found was that, there was a very beautiful response, the fetal heart rate. There was a beautiful correspondence between the maternal and the fetal heart rate. Again, bringing in the connectivity between the mother and the fetus, establishing that. And the fetal heart rate, which was, very, very significantly regulated while listening to Om, and in the makara phase of the pranava pranayama, when the mother was chanting, there was a the baby seemed to be very, very alert, is what the mothers felt. Mothers experienced more of the fetal activity, alertness during these two. And the palliation during this stage, developing a better bond with the fetus. And the other thing was the Sukha Pranayama, a slow, deep breath, inhale for 4 counts and exhale for 4 counts again, which is pranayama, which is safe and very, very effective also. Again, this made them feel very relaxed, sensed, the active fetal movements, because more often in our the OG ward where women are admitted there, and when they were, the non-stress test to record the fetal heart rate, usually that is done. And during that, the baby is often sleeping, which means they are not able to record the fetal parameters much when the baby is sleeping. So they'll ask the mother to, walk in the corridors for some time, do something so that the baby is alert and awake. Simple pranayama gets the baby alert and awake. And the changes, the sympathetic overdrive, the stress because of the pregnancy, and what are the outcomes going to be, what is the baby going to be. So many things are there, the physical stress, the emotional stress that she carries, everything is affecting her. And all this is regulated, bringing down the sympathetic activity, enhancing the parasympathetic vagal tone, and ensuring enhanced placental circulation, the circulation through which energy and nutrition is supplied to the fetus, leading to healthier fetal development. And postnatal care, which is very, very vital. Nilachal, is the sun on me? Is it like glaring or something? You want me to close the door?
Yes, ma'am.
Yeah.
The sun is coming on your face, ma'am.
Just excuse me. I will just do that.
In the meantime, all are requested to keep your questions ready. You can mention them in the chat box or the question answer section. And yes, ma'am.
Yeah. Is it okay now?
Yes, ma'am.
Yeah. There's no current, so I had just left the door open for light. It's okay. Now I think it's better this way. So the postnatal care, which is very important once a baby is born, the care that goes with it is also important for the mother and the baby. So Ammaji's, words on conscious motherhood, pregnancy and motherhood, Ammaji says, are most profound spiritual acts a woman can perform. Through yoga, young women can prepare their body, mind, so that the conception and childbirth becomes a conscious, sacred process, producing healthy and spiritually potent children who can transform the future of the planet into Garden of Eden. Isn't that so beautiful? And sacred role of women, where Amaji says the female principle is Shakti, the mother energy of the universe. Prana is Shakti too, the creative, sustaining, transformative force of life, right? So she is equating that and this. And the other research studies that practicing yoga during pregnancy is going to be very, very beneficial. And midlife, the menopausal stage, 40 to 59 roughly. So this broad stage involves the premenopausal, perimenopausal, menopausal, as well as postmenopausal hormonal fluctuations depending on what stage a woman is in. The other most important factor which we have to think about is the osteoporosis, the bone health, and the muscle tone, which decreases. Apart from that, the joint stiffness, which seems to increase, leading to arthritis, the rheumatoid or degenerative osteoarthritis, and all that. The cardiovascular health decreases because, as you know, the hormone estrogen production is decreased. So we have to be very vigilant about that. Weight management and metabolic changes. Weight management becomes a huge challenge in this stage. Mental health, especially focusing on the empty nest syndrome, because all the children, till then she would have been busy with the children, but now the children have gone away on their own, for higher studies, or they would have established their own families, and they would be outside, the midlife crisis leading to all this. And the rationale behind the practices that we give, the yoga therapy, to reduce the menopausal symptoms such as the hot flashes and irritability, mood swings. All these are part of the menopausal, the symptoms that are there. And support the health of the reproductive organ, and the pelvic strength needs to be sustained. Improve the sleep quality, because sleep is a big problem during the menopausal stage, often disturbed because of hot flushes and all that. And the quality of life, which seems to be diminishing now. The midlife is often associated with more career pressures and more family responsibilities, and emotional support, which is very, very essential, because this is one stage where woman is very low in self-esteem because of all that changes that are happening. One, the physical appearance, the aging that is related with that, and the emotional strength is completely depleted. So the practices focusing on all these aspects needs to be given to them. And all these kriyas and the other practices. One practice which to me personally was very, very beneficial from our the tradition is the Shabda Pratyahara Kriya, because the noises that we often start focusing outside, and then slowly we start coming within, and all that emotional noise that is going within, all that, your limbic system going shouting at yourself, you're no good, you're not a you're waste, you don't look good, you look ugly, you're aged, your hair is becoming white, and your skin is wrinkling, blah 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 blah. All these noises which can be focusing within, and focusing on this noise, and then slowly going through that, and then coming out of that, silencing yourself, silencing the mind, which is so beautiful. um, Yes, on being a mother. Amaji, again, to be a mother is not to just give birth to a physical body, it is to nurture, discipline, guide with spiritual values, blending love and dharma into the new life. And you all see how she has done. The live example is right in front of you. Hmm? Dr. Ananda Balayogi Bhavanani, sir. And shaping the future generation in harmony with the cosmic law, which is very important, right? We are living in this universe, so we have to be aligned to all this. And being a woman, Amma says, is not a limitation but a divine gift, a pathway to embody Shakti, the creative power of the universe. And older adulthood, 60 plus, where the Gitananda Rishi culture yoga tradition, women above 60 are guided gently yet powerfully into the practices that sustain health, that regulate their dignity, self-dignity, self-importance, and inner joy in later life. And the primary health concerns based on which the yoga therapy need to be prepared for this age is chronic disease management, because diabetes, hypertension, arthritis are all common problems in this age. And then the cognitive health, dementia, Alzheimer's, Parkinson's, many of these, begin setting in. mobility and prevention, fall prevention. We need to focus on that, the balancing ability and social engagement, because slowly they start becoming isolated, and they start living on their own, and they do not like to mingle with others. And many often, where I did my research study for my PhD. It was with geriatry. The women refused to even get out of the bed because they were, the whole sense of purpose, the sense of meaning in life is gone. Why should I live is their question. What is the big use in me doing yoga? Why should I be active? Why should, there's no meaning in life? There's no hope in life. So that is all, yoga is really, really going to help, all these problems and bring them out of it. And again, like I said, the osteoporosis, which is a big, big issue. The suggested practices focuses on, many practices may be done with them, but it should be easy, and there should be a natural flow, focusing on stability and support that needs to be given. And discipline, diet, rest, positive attitude needs to be inculcated in them, cultivating the bhavana, the right attitude, towards aging, letting go, and then acceptance, gratitude, all these need to be inculcated. Dietary awareness, the dinacharya, how to maintain your routine in sync with the circadian rhythm, the rhythm of the sun, where as it rises, as it sets, how to align your everyday activities with the cycles of the sun. And what needs to be done, the precautions, again, listen to the body. One, I always keep saying that, are you doing, appropriately as much as your limitations, or are you looking at others and overdoing it? Are you being over enthusiastic about it? So that needs to be, like, listen to your body, listen to your mind. And always ensure that in the yoga class, yoga session, the body movements are often always synchronized with the breath, and not forced, or the breath is not held. So these are a few pictures from, you can see all these elderly women doing the practices. It is not for photograph, they did it, and till date they are continuing. And all this was done in a chapel. Believe me, this is all done in a chapel in a Christian institution, Joseph of Saint Cluny. And you can see that the sisters themselves, the Mother Superior was one of the subjects for my research study. And Swamiji, on the importance of nutrition. From adolescence to the menopause and beyond, maintaining a proper nutrition is very, very important. And the nutritional needs of women, as you saw, different needs in different stages. The nutritional needs are also different. For example, the adolescent girls require more calcium and iron, and adult women, that they need more vitamin D, calcium, and also for the bone health, support the bone health. And again, it has to be given to them the proper nutrition, sattvic diet, as they keep stipulating on foods that support growth, and not the old negative thought creating tamasic food. And traditionally, women cooked not just to feed their families, but to sustain dharma itself. Preparing food with love, offering it first to God, what we call naivedya, making it a prasad, and sharing it with others. In this, woman becomes the very keeper of Sanskriti, culture, transforming the basic instincts, something like hunger, into higher values. Again, Amaji for you. So, the hormonal compass guiding women's health. Throughout, as we have, again and again seen the hormonal changes. So, the physical symptoms also vary with the hormonal change. especially, in the adolescent stage during the menstrual cycle, just before, many girls have headaches, the migraine headaches, which are triggered, or the mood swings, the PMS, as we call it, the premenstrual syndrome. All this is related to the estrogen dropping, levels of estrogen dropping down. And then the weight gain, like we've already discussed, BP increasing, the blood pressure which rises, and then the depression, mental fog, stroke, autoimmune illnesses, endometriosis, breast cancer, infertility, etc. All these are some of the issues that the hormone swings can cause or worsen. Again, yoga is a holistic tool and an art of living, not just a practice of asanas or pranayama. This is a complete package which covers all the dimensions of health and prevents and supports, helps cure women in all the stages of life. The key takeaways: yoga as a lifelong companion, again, not just exercise, but a way of life guiding women through each stage of theirs and ensuring holistic well being. The Sukha Sthanam, as Sir was saying, from that stage of Dukkha into that state of Sukha, from that despair to ease and comfort, where you are at ease and the dis-ease is gone. And the special role of women, who are the nurturers of society, as Amma calls them, the Shakti principles. And therapeutic applications, as we saw, each and every concern in women could be addressed by implementing yoga therapy. And stress management and inner balance. Yes, yoga ensures the autonomic balance and the moderation, the balance, the samatva yoga, samatvam yoga uchate, whatever you name it, it is there with yoga. And the workplace stress alleviating, the way you perceive things changes, the way you approach, modify your approach to the stressor, and so many things. The woman changes, the attitude, the bhavana is changing, all the negativity is replaced, the pratipaksha bhavana, right? She becomes more resilient, mindful, and there is emotional equanimity. For empowerment, yoga empowers women to rediscover their inner strength, creativity, and the spiritual potential, enabling them to live as the Shakti Swarupini, the embodiment of divine energy, or Shanti Swarupini, as they are called, the Shanta Bhava, peace. Women as embodiment of peace. So again, the studies which suggest the chronic stimulation of the sympathetic activity, the stress, everything that goes with the lifestyle. And what happens is, with yoga, all the dysregulation is reversed. So the hypothalamo pituitary ovarian axis is regulated, promoting health in women. Many scientific studies have been done, and like reducing insomnia, menopausal symptoms have been alleviated, perceived stress improved, sleep, the mood changes have been addressed. You can go on and on and on. And this is very important. The dysfunctional uterine bleeding has been regulated by reducing the perceived stress and state anxiety and improving quality of life. So by reducing, by addressing the way you approach stress or stressful situations, or address a problem with yoga therapy, it is changed, and that is what is shown here. And somatoform symptoms, this is a very common part in women, which is mimicked as a physical, something that happens in the mind is mimicked as a physical symptom, especially, and it is associated with the menstrual disorder. And they find that this has been addressed with yoga. and so on. Every stage of pregnancy, studies have been done establishing, and next time I meet you all, I'll also be talking about how the sleep deprivation, we are finding very, very positive results, how sleep deprivation is being addressed, is being, like the sleep quality is enhanced with yoga therapy. So on the lighter side, mental illness, menstrual cramps, mental breakdown, menarche, menopause, gynecologist, and when there is real trouble, it is hysterectomy. Have you all noticed how all of these women's problem start with men? So this is a story which is like, a teacher is asking the children to carry a bag of potatoes in their bags just to teach, something to them. And they carry it for 4 days, 5 days, 6 days, after which it starts stinking, and they are not able to bear the smell carrying it in their bags. So the teacher says, simple thing, throw it out of your bags and things will get better. So what happens in human life is we keep on storing things which are of no use, carrying baggages and baggages and baggages of junk. Like sir was speaking about junk in the body, junk in the mind, junk in the emotions. All this, totally changing the personality. They are changing your attitude, changing your habit patterns. Everything is changed. The simple thing is, what can we do? Hold all these things tight and whoosh all the negativities away. Let go of that and replace them with positivity. Fill it within all the joys, the Shanta Swarupini, the Shakti Swarupini, the woman is. Woman is the full circle. Within her is a power to create. She can, create, and then she can nurture, and she can transform the life. One good thing is that she can create. But when, like for example, in the when we think about the asuras, she can also destroy. There's what we call as the Sahana Shakti, the power of endurance. There's immense power in women to endure. But the moment it snaps, it becomes very difficult to control that. And one best technique for every woman, for every one of us, a simple thing. You can take any guess that you want and you can put it in your chat box also. Let's see how many of you find it right. Just one technique, that will do. Okay, are you all ready? Have you all given it? Ready? 1, 2, 3. The smile. That's it. Everything is gone. The whole physiology, the whole anatomical changes, all the hormones, everything, the whole equation changes with the smile. That's it. And in conclusion, what I would like to say is that yoga is not something that you learn how to do. This is something which each one of us should experience. It is anubhuti. It's an experience. It is anubhava. And yoga is not the subject. It is not subject that which can be taught. Yes, of course, the techniques can be taught. It has to be taught. The theory, sometimes, yes. But how do you live it? How do you experience it? How do you learn it actually? By living it. And, the more you live it, it gets fine-tuned. And each technique, like Amaji, often I've heard her say, the same Surya Namaskar done millions of times, but every time it gets better and better and better and better. And every time your experience in that particular technique is going to be different and it gets better. And this is not something, it is not a subject of study. We are the subjects, and we have to experience all
There may be some technical issues, requesting all to be stay. And in the meantime, like how we mentioned earlier, you can write your questions and your sharing in the chat box so that when ma'am join, we can ask her the questions that you ask. Maybe ma'am is joining again, but isn't it very interesting that there are a lot of things techniques and all that we have
Irachalji, your voice is cracking.
this whole
Irachalji, your voice is
tradition,
breaking.
and from the very big sharing, it was really interesting in that the Shakti that is there, which is the so important way. So it is very important. So internet plays a very important role in all these things, and with the internet, we are there. And here Meena ma'am has joined again. Yes, ma'am.
Yeah, so I'm really sorry about that. The current is completely gone, and my laptop has shut down also, because, like I was telling you right from the beginning, the battery was low. But the conclusion slide I had come. So as I was saying, the change should come from within, and that can come only when you are prepared, mentally prepared, emotionally prepared to accept the change, instead of victimizing yourself. I'm the victim, I'm a poor thing, everything around me is wrong, everybody around me is wrong. The attitude of gratitude, which is very, very important. And okay, I'll be ready to take up the answers. Am I there?
Yes.
Yeah.
Thank you so much.
Thank you so much.
Thank you, our smiling Shakti Swarupini, Dr. Meena Ramanathan ji. Thank you for sharing your profound insights with us, and truly appreciate each and every presentation of the slides that you have shared. I think I will have to, like, all of us will agree that we will have to go back again and again to each of the slides. There's so much learning in it, and how beautifully you have presented and highlighted how yoga can nurture strength, balance, and healing for us women at every stage. The hormonal compass, beautifully presented. So yeah, we'll take the first question. That is from Neeruji. Should we worry about the low BP in healthy pregnancy by giving Chandranadi pranayama?
Should we worry about low BP in giving Chandranadi pranayama?
For healthy pregnancy?
You have to constantly keep monitoring the BP. If they feel that by giving Chandranadi pranayama, it is going down beyond that, below that normal range, then I think you can stop doing the Chandranadi pranayama. Instead, do the normal Sukha pranayama, which might be better. But again, constant monitoring is very essential, especially in pregnancy. But I don't know whether there will be any harm caused because of Chandranadi pranayama, because one of the studies done in JIPMA by Sir and his team, Surya Nadi pranayama was found to be safe even in hypertensives. So pranayama, if done mindfully, I am sure it is not going to cause any harm. But for some reason, if in this particular woman, if the blood pressure is going below the normal expected range of the BP, then she may stop it and continue with the normal Sukha pranayama, Dirgha pranayama. All that could be continued.
Thank you, ma'am. We have another question from Dr. Balaji. The addiction rate in women has rapidly increased in the last 5 years. As per survey, 1 woman in 17 men. So he's requesting you to please share your views on this.
Is it active? Yeah, sorry. Yeah, the rates, yes, it is going high. One is the peer pressures. People think escapism is the shortcut. What they do not realize is it is a web that once they put their finger or foot in, it's going to pull them deeper and deeper into that. They just think about that one moment of escape when they are, addicted to either tobacco or any drug or whatever it is. And I truly appreciate Balaji for taking this up, because he is doing a lot of work with the de-addiction clinic now. And we are also coming up nowadays with one of the master's program as well as a PhD program in the de-addiction clinic. And we hope to bring you more such things. And yoga is definitely a boon for all these women who are caught up there, to bring them out, to give them the courage to come out of this. Because once they are caught in this, it's like a quicksand. It just pulls you within, and they will not know how to come out of it. So we have to extend our hand, but ensure that they do not pull you inside, but you can push them, pull them outside from that web they are caught in, and help them with, the blessing of yoga therapy. Thank you.
Thank you so much, Dr. Meena, for that. Also, we have comments coming in from Sri Devi. She mentions, thank you very much from all my heart for this wonderful overview of women themes. You are the best example to all of us. Garima Sethia mentions, what a beautiful presentation. Ajay Kumarji also mentions a thank you for power-packed session, ma'am. Raja Lakshmi ji mentions, excellent session. Thank you so much, ma'am. And Bharataji mentions, thank you, Meena ji, for your wonderful, very informative presentation. You are tremendous role model for all of us. And also Mandavi ji mentions, thank you for the very inspiring presentation, very helpful knowledge. We have, I'll take a question now. So it is from Ramesh Kumarji, who asks, weight management techniques after delivery. Ma'am, you're muted.
Yeah. From my mobile back to my screen, the current came, but then, so now, weight, yes, that's a big, huge issue after delivery, because two aspects need to be taken care of. One is what you eat. Two is how much of exercise you can do when you do it. because the focus, the mindfulness when you are exercising, how much of calorie you can burn, because you cannot strain the body after delivery. So you need to be very, very careful what you burn up and how much you can burn up. But because you had need to focus all the energy on the baby also, that is why the postnatal care of both the woman and the baby is very, very essential. Yes, the practices could be done. If it is normal delivery, after 2 months, you can start doing all the practices. If the woman has been a practitioner from her early age, it could be continued now and then started over. Just be careful not to overdo any of the practices, especially while stretching. And if it is an LSCS where surgery has been done, care, because of the internal sutures, care should be taken for the next at least 6 months for the healing to occur. But pranayama, the meditation practices, mindfulness, the shabda pratyahara, like I was saying, and then prana dharana, dharana on om, pranava dharana, pranava dhyana, omkar chanting. All these are going to be helpful in promoting the healing energies and to, heal within completely. That is going to be there. And it also has to be supported, one, by the family, two, by the proper nutrition. That needs to be there. And everything, all this, the support, because that is one stage where the dependency is going to be there by the woman. So the support, the more the support she gets, the more the encouragement, motivation she gets, the quicker she can come back into normalcy.
Thank you, ma'am. We have one question from Ramesh ji. Ma'am, what is your advice on PCOD for 24 to 30-year-old ladies?
Do you mean techniques? Does he want the techniques or suggestions? Is there anything
Ma'am,
specific?
he has just mentioned your advice.
Okay. So advice, one is because with PCOD, what happens is that weight gain is happening. There are so many other symptoms that are associated with PCOD. Like I was saying, the hirsutism, what hormone is affected, what is the problem, what is the status quo, is there any medication that has been suggested, the USG, which speaks about what is the status quo of this PCOS. So many factors need to be taken into consideration, and the techniques that could be done will be focusing on the pelvis health, ensuring the health of the pelvis, the retaining the strength and the flexibility to remove the congestion from the pelvic region. That is something which we need to focus on, especially with the with the PCOS issues, be it whatever stage it is in. If it is adult or adolescent, adult, whatever it is, these are some things. And then the nutrition aspect, go low on fat. Healthy fat is good, omega-3 fatty acid is good. Go low on fat and then more on protein, and health-based diet is very, very essential. Nutritional aspect needs to be under vigilance, very, very careful vigilance. And if the doctor is suggesting metformin or other medications which need to be taken as an adjunctive, please tell them to go ahead with the medication, not to stop the medication because yoga therapy is done. But we have found instances where doing yoga therapy along with the medication, and there is one stage where you can slowly come off the medication and go ahead with the yoga therapy alone. But it takes some time, regular practice, regular, dedicated, like Ammaji says, repeated, rhythmic, and regular practice needs to be done. Dedicated practice needs to be done. Otherwise, it's one day, you do 3 hours, and then the next 3-4 days, you don't do anything at all. It's not really good. So regularity in the practice is very essential.
Thank you, Dr. Meena. I'm sorry, this question was not from Ramesh, it was from Ajay Kumarji. Apologies. And also, I see Professor Ingen Hagen has also joined us today.
Yeah.
Welcome, ma'am. So, as we all are aware that tomorrow she will be sharing her insights on the integration of yoga into psychosomatic healthcare. So, for today, ma'am, you want to share your views? So,
Thank you. First of all, Dr. Meena, amazing presentation. And I think you made it so clear that yoga is so relevant for women at every stage of their development. And that was very insightful. Sometimes when we practice yoga, we do it, or many times in most classes, there are men and women. But what is common for us? That's what I was thinking, because it's seldom that I think that women are so special, even though through pregnancy and hormonal system, and our whole life, we actually live a quite different life in terms of our body. But at the same time, we also, when we practice yoga, we do it in a very similar way. So my question is more, could you reflect on where we are similar to? Because you really highlighted in a very beautiful way the way women are special or different.
Equality, yes. Though, physically, sometimes with all these issues, the hormonal changes, the irritations, the emotional issues and all, makes women, known often as the weaker sex. But she is no less to any man. Like I said, the strength of the pelvic girdle that can hold so much makes her the strongest. And the pain she goes through, the delivery, the labor pain, what the intensity of pain, they say, is like so many times more than what a body can bear, what a body can endure. And she endures that and comes out of it alive. So I don't think she is any less. But because of this special, the changes that happen at every stage, some important considerations need to be taken. But if you are in a common class, absolutely no problem. All the techniques that a man can do, a woman can do. But during the menstruation, we take care that the leg lifting postures are not done because of the endometriosis issues that may arise because of that. So any positions where the legs are lifted, where the pelvic region is below and the legs are lifted up, say for example, Ekpada Uttana or Dvipada Uttana Kriya or Viparita Karni, Sarvangasana, all these need to be avoided during menstruation. So that is something which has to be taken care of. And very jerky movements, the jerky, forceful movement, say like in Surya Namaskar, sometimes we jump backwards or we jump forwards. So during especially menstruation or pregnancy, if it is being done, we need to take care to avoid such movements. But otherwise, the stretching, I have often in classes found a few women are not so comfortable, doing Trikonasana or Virasana or postures where the legs are stretched, that is again depending on the individual. It's not that they should not do it, but if they are not comfortable doing it, they need not. So in a common class, what we would do is like we would just tell them not to do things which they cannot do. So listen to the body that, when we are doing a posture which is not good for them, which they're not comfortable, they will just sit or they will just stand, observing the others. Oh yeah, very good. You're all doing good. So what can I do now? Can I help you with it? So that is the attitude that, just motivate them into that. Again, I come back to this point where listen to the body. Don't overdo. Don't be over enthusiastic. Enthusiasm is important, but not over enthusiasm. Confidence is important, but not overconfidence. Respect is important, but not over, the egotistic thing that happens. Self-respect is important, but not beyond. So again, coming back to what yoga says, samatvam, moderation.
Thank you for your wise answers.
Thank you. So we'll take another question that is from Bharti Patelji. High BP in menopause, how to manage without allopathic medication?
Okay. So if they are pre-hypertensives, it is very good. But if they have been just diagnosed and if the BP is kind of, say, normal range of a blood pressure is 120/80. And they say that it is a range, 120 meaning 100 to 140 is okay. And the diastolic, which is 80, so 60 to anywhere between 90, 60 to 90 is said to be okay. Normal, things. If it is very much beyond that, then medication is very essential. Because of the menopausal hormonal changes, sometimes only yoga therapy may not be helpful because they need to be truly, truly dedicated. If they have been just introduced to yoga therapy only now, they may not be so proficient. They may not be able to do all the techniques or all, because there are many, many mechanisms which, regulate the blood pressure in the body, like the baroreflex mechanism. All these, the sensitivity needs to be adjusted in the baroreflex, the techniques that could be done. Yes, we can try it for say 1 week or so. But if the effect is not really happening, then better to go with medication and yoga therapy, and slowly, because they have just started, slowly come out of the medication and continue dedicatedly and sincerely with yoga therapy. But in the beginning, it is always, especially, the symptomatic things that goes with blood pressure, sometimes headache, sometimes dizziness, blurriness of the vision. There are many, many other things that goes with it. So what are the symptoms? Are they able to manage it symptomatically? Again, when managing blood pressure, it is not just taking medication or doing yoga therapy, say Chandranadi pranayama or Pranava pranayama or Bhramari pranayama. All this is going to help. But most important, the other important factor in managing your blood pressure is the nutrition, is the diet. What are you taking? What the hydration? Are they having enough hydration? Because the osmoregulation of the blood, which is very important, many times all these are, taken for granted, that they are all taken care of. But these are very, very essential factors. Caution, again, caution needs to be taken. And they have to, not just go with the TV or, YouTube or books which suggest these practices are good. If you Google, there are so many practices which have been given. YouTube videos are available. But for this particular individual, what is good, they have to take care, like take the advice of a qualified yoga therapy consultant or a qualified therapist with the medical advice, and then they have to go ahead, without which it is not advisable at all.
Thank you, ma'am. We also see Yogacharini Sri Devi ji from Switzerland. I invite you to please unmute and share your views and yeah.
Okay.
Namaste, Sri Devi.
Namaste. This is a surprise. So, Meena, you really did a very good job, and always when I hear you and see you, I'm amazed by your big knowledge, and now especially for the women from the birth till the old age, and it's just wonderful to hear you with your experience. I just wanted to thank you. I have nothing to add. It's great. It's really great. Thank you very much.
Thank
And
you
keep
so
going.
much. It means a lot coming from a senior person in this lineage. So thank you so much. Thank you.
Thank you. Dr. Meena, we do have few questions. So it is from Bharti Patel ji. High BP in menopause. How to manage without allopathic medication?
I think I just
I'm sorry.
answered.
I'm sorry, miss. I'm sorry. Apologies. It is from Dr. R. Balaji. The rate of infertility clinics is more because of a double increase in the infertility cases. In spite of it, India is #1 in the world in terms of population. Ma'am, your views on it.
The lifestyle taken nowadays, the mental attitude, everything is pronounced as stressful. Anything and everything is, channelized as stress, leading to faulty lifestyle. Everything, the achar, vichar, ahar, vihar, that whole equation that has been, and the social vyavahar, the fifth component. Is there any relationship in this? Are people living this life? Despite all the awareness factors that have been given, despite all the technological improvements and advancements, what is still lacking is the attitude. What is good, what is bad? Discriminate. What, again, what do you perceive as good? What do you perceive as bad? Right? There is so much that we need to think about. Right? All these, and the regular lifestyle from their young age, how are they brought up? The fast food that is, like zooming now. What is happening with the fast food? What is happening with the physical, the anatomical changes? And you are ultimately what you eat. So what is happening to your mind because of whatever you eat? You're loading yourself with junk. Again, like what sir said yesterday, junk is what is getting filled. And all this is taking its toll on your physiological functioning. Normal, whatever the normal functioning of the genitals is not happening. So the hormonal, issues are happening now because of all this. Again, leading to fertility issues. Like he very beautifully pointed out, in Pondicherry, if you see, any signal that is there, there will be one fertility clinic. It is almost as if every important road in Pondicherry has a fertility clinic. Despite the fact that, all these cultural aspects and all these positive thoughts and awareness programs and, the traditional values have been placed in them, but still, again, the westernization. But westernization is not really the problem, because the Western society is now taking up all these factors. They are absorbing all this, and there is a huge change that is happening there. But what is happening here? It's actually pathetic. It's very pathetic. When women come and tell us, for consultation, they say that IVF, it has been failing so many times. They go into depression because it is not working out. And you really struggle to, talk to them, because you don't know what to tell them. Everything is wrong, whatever they have been doing. So how do you tell them to change the whole thing? Right? From A, B, C, it has to be redone, readdressed. How do you really do it? There has to be a basic, alignment which needs to be done, and something which has to be completely changed. I'm sure it is not impossible. If they can do it, yes, we can come out of all this. Fingers crossed. Let's hope for a time when all this will change. Hope keeps us going, right? Hopes and prayers.
Yes, that's right. Thank you, ma'am. We have two more questions, last questions. So, Niharika ji has asked, can we alter autoimmune thyroid in women?
Autoimmune issues. We are right now doing autoimmune rheumatism, rheumatoid arthritis. We are trying out with a research study how it can be reversed, and it is working. It seems to be working. The autoimmunity seems to be getting reversed. If not 100%, at least 70 to 80%, it is getting reversed. With thyroid, I am not, because you have only mentioned thyroid, you have not mentioned if there's anything else that is associated with it, because there are so many other factors which needs to be thought about in autoimmunity. Uh, but attempting is not a problem at all. What is stopping you from attempting? Please consult a qualified, a consultant with the medical assistance and a yoga therapist. I am 100% sure it will take on. They will be able to, and apart from all this, faith and conviction, your trust in the practice, the system that you are doing, that definitely helps a lot as far as such conditions go. The faith, 100% faith, and there will be 100% change. Again, if not 100%, at least 50 to 60%, it can start. And slowly, yes. And what is the stage they are in? Is it grade 1, grade 2, grade 3? What is it? Is it just has it been just diagnosed? Then it might be reversed. Yoga therapy is very, very amiable in stage 1, stage 2. Like we say, psychic, psychosomatic, somatic, and organic stages are there in the progress of every disorder or a disease. So psychic and psychosomatic stage, the reversal back to stage 1 is possible with yoga therapy. But once it becomes organic, once it is settled in the body, reversing might not be possible. But yes, of course, we can stop the progress, of course, into the other, psychosomatic to somatic. Instead of becoming organic, you can stop the progression of further deterioration and try to retrace it to decent, levels. I would say dedication, faith in the system matters a lot in this.
Thank you, ma'am. So today's session beautifully highlighted how our Gitananda approach to yoga chikitsa is, and it offers deep healing and empowerment for women's health. You gave us simple practices, gentle breathing, mindful body awareness, listening. Listening was the key factor that you focused on today, ma'am. Yeah, listening, letting go, absolutely, and also ati, of not overdoing anything. Thank you so much. This, I'm sure, will it supports us women in balancing our mental, emotional, physical, and spiritual well-being. I'm sure this approach will strengthen and nurture us to be that calm and confident Nari Shakti. All right.
And we
thank-
have Ammaji right there, who's been the symbol of all this represented life, the epitome of all this. So when she is there, like what is said, why fear when I am here? So that's, whenever I talk to Ammaji, that's what, be good, do the practice. That's it, right? So let's be that good person. I'm sure that sincerity, dedication, the faith, all this is going to, lead you into some beautiful place in this world. And yes, we are all in that, what do we say, the womb of the tradition, right? The Gurukula. So always protected, always nurtured by the Gurukula. So definitely, yes, we are all there. Connected, healthy, nurtured.
Absolutely, ma'am. We are very grateful for your presence and your dedication. You're truly inspiring. Thank you. Thank you so much, ma'am. And also, yes, as a small reminder, tomorrow we have a session by Professor Dr. Ingen Hagen, who will be sharing her insights on the integration of yoga into psychosomatic healthcare, highlighting the therapeutic perspectives of the Gitananda Yoga tradition and its applicability to holistic mental and physical well-being. So I hope to see you all again tomorrow, and I appreciate each one of you for your attentive participation. So let's end with a Shanti mantra. Om Loka Samasta Sukhino Bhavantu Sarve Janaha Sukhino Bhavantu Om Shanti 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 Om. Thank you.
So thank you all so much. Thank you, Nilachal. Thank you, Dia, for conducting it so well. And see you all tomorrow. Much, much recommended. Dr. Ingan's speech. I'm looking forward to it too. So see you all again. Take care. Bye. Cheerio.